Hey everyone, and welcome back to Student Nurses Station. I'm Nurse Don.
And I'm Nurse Jill.
So glad to have you all back with us for another deep dive into the world of nursing.
Before we really get started, just a quick reminder to hit that like button and share this episode with your fellow nursing students.
Oh yeah, definitely can't forget that. And while you're at it, go ahead and subscribe so you don't miss out on any future episodes.
We love seeing your comments too, so feel free to let us know what topics you want us to cover.
Absolutely, we're always looking for new ideas.
And speaking of helpful resources,
Oh yeah.
don't forget to check out the link in the description for free downloadable nursing books.
Yes, those are perfect for those late night study sessions, or even if you're just, commuting or doing laundry, multitasking like that.
Exactly.
So all right, let's jump into today's topic.
Okay, so today,
We're going to tackle something that can be,
pretty intimidating.
especially when you're new to nursing. The nursing care plan.
Ah, NCPs.
Oh, yeah.
We all had to learn them.
Oh,
And sometimes they felt like learning a whole new language.
exactly. But
Yeah.
they're so vital to nursing practice. It's really like a simulation of what it's actually like to be a nurse, thinking critically and making decisions about patient care.
Right, and I think what's really fascinating about nursing care plans is that they reflect the cyclical nature of nursing itself. You're constantly assessing, reassessing, and adjusting your approach based on how the patient's responding.
So it's a dynamic process for sure.
Definitely.
Well, let's start with the foundation then, the assessment phase.
Okay, so assessment.
This is where we put on our detective hats.
Exactly, we're gathering all those clues, those pieces of the puzzle to really understand what's happening with our patient.
And it goes beyond just, collecting vital signs and lab results.
Right.
It's about getting that full picture, both the subjective and the objective data.
And that subjective data, the patient tells us is crucial. It's
Yeah.
their experience of their own body, their pain, their fears, their hope. All of that plays into how we approach their care.
Like, for instance, a patient might say, I'm feeling really anxious about this surgery.
Okay.
Now, that's a subjective cue. We can't measure anxiety on a scale,
Right.
but it's a crucial piece of information.
Absolutely.
And then we have the objective data, the things that we can measure,
Right. The measurable things we can observe.
like vital signs.
Yeah. Physical exam findings, lab results, all those pieces of the puzzle.
So let's say our anxious patient also has an elevated heart rate and blood pressure.
Okay.
Now we're starting to see a pattern emerge.
Exactly.
We're connecting those subjective feelings of anxiety with the objective physiological responses.
And by weaving together both those subjective and objective data points, we start to form a deeper understanding of the patient's needs.
And this assessment phase isn't just about what we see and hear.
No, it's not.
It's also about delving into the patient's history, their medical background, their lifestyle, their social situation.
Because all of these factors can really impact their health and well-being.
Right, like a patient's cultural background might influence their pain tolerance or their willingness to accept certain treatments.
Exactly. And their social situation, if they live alone or if they have a strong support network,
Yeah.
that can affect their recovery and their ability to manage their health.
And it's during this assessment phase that, those communication skills we've been working on really come into play.
Oh, absolutely.
Building rapport,
Yeah.
active listening, empathy, all of that helps us gather accurate and complete information.
It's about creating a space where the patient feels safe and comfortable sharing their story with us.
Sometimes that might mean navigating language barriers or cultural differences.
Right. And we also have to be mindful of things like anxiety, pain, or even, medication side effects that might be affecting the patient's ability to communicate clearly.
Right. So we're really paying attention to those verbal and nonverbal cues, recognizing those subtle signs that might tell us there's more to the story than what's being said.
Absolutely.
Now, once we've gathered all this information, we move into the diagnosis phase.
Okay.
And this is where it gets really interesting.
Yeah.
We start to make sense of all those clues, analyze those patterns, and put together a picture of what's going on with the patient.
And it's important to remember that we're talking about nursing diagnoses,
Right.
not medical diagnoses.
So doctors focus on disease processes.
Right. But as nurses, we're focusing on the patient's response to those diseases or other health conditions.
So for instance, a patient might be admitted with pneumonia.
Okay.
That's the medical diagnosis.
All right.
But our nursing diagnosis might be something like impaired gas exchange,
Right.
because we're looking at how that pneumonia is affecting the patient's ability to breathe and oxygenate their blood.
We're focusing on the human experience of that disease process
Right.
and what we can do to support the patient through it.
And it's important to remember that, these nursing diagnoses aren't just pulled out of thin air.
No, they're not.
They're based on established frameworks like NANDA, which provides a standardized language for nurses to communicate about patient problems and interventions.
And that standardization is so important because it allows us to speak the same language no matter where we are in the world or what type of healthcare setting we're working in.
Right, it ensures consistency and clarity in our care.
Exactly.
Okay, so let's say we've analyzed our assessment data and we've come up with the nursing diagnosis.
Okay.
What happens next?
Well, now we move into the planning phase, which is all about setting goals and figuring out how we're going to help the patient achieve those goals.
So it's like we're charting a course, setting our GPS coordinates,
Right.
and figuring out the best route to get to our destination.
And just like with any journey, it's helpful to have a roadmap.
Yeah.
And in nursing, that roadmap is the nursing care plan.
It guides our actions
Yeah.
and helps us stay focused on those patient needs.
And those goals we set, they need to be SMART goals.
Oh, yes, SMART goals.
Specific, measurable, attainable, relevant, and time-bound.
Right.
We want those goals to be clear, concrete, and achievable within a specific time frame.
So instead of just saying, we want the patient to feel better,
Right.
we'd say something like, the patient will ambulate 10 feet with the assistance of one person by the end of the shift.
Perfect example.
Now that's a SMART goal.
It tells us exactly what we're aiming for, how we'll measure success, and when we expect to see results.
Okay, so we've got our diagnosis and our SMART goals.
Okay.
Now what? We need to figure out how we're going to get there.
Right, and that brings us to the interventions.
Okay.
The actions we're going to take to help the patient achieve those goals.
And these interventions can be independent, dependent, or collaborative.
Right? You got it.
So independent interventions are actions that nurses can initiate on their own without a doctor's order.
Like repositioning a patient to prevent pressure ulcers.
Okay.
Or providing emotional support and education.
Then we have dependent interventions, which require a doctor's order.
Things like medication administration or specific wound care treatments.
And then there are the collaborative interventions, where we're working with other members of the healthcare team.
Like physical therapists, dietitians, social workers to provide holistic care.
It takes a village.
It does.
Healthcare is a team sport.
Absolutely.
So we've got our interventions all mapped out.
Okay.
What's the next step in this journey?
Well, now it's time to put that plan into action, the implementation phase.
This is where we take all those carefully laid plans
Yes.
and actually start doing the things that'll help the patient achieve their goals.
But before we dive headfirst into implementation, it's crucial to prioritize our interventions.
Okay.
We can't do everything at once,
Makes sense.
so we have to figure out what needs to be done first, what can wait, and what can be delegated to other members of the healthcare team.
Right. We have to consider, things like the patient's current the urgency of their needs and the resources that we have available.
Absolutely. So if a patient is having difficulty breathing, for example,
Right.
our top priority would be to assess their airway and ensure adequate oxygenation.
Right.
That would take precedence over things like ambulation or medication administration, which could be addressed later.
It's all about critical thinking, using our clinical judgment
Exactly.
to determine the most appropriate course of action.
And once we've prioritized our interventions, we need to implement them skillfully and safely.
Right. Always keeping the patient's comfort and well-being at the forefront of our minds.
Absolutely.
And of course, we need to document everything we do. Every assessment, every intervention, every patient response.
It all needs to be recorded accurately and thoroughly in the patient's chart.
Documentation is key.
It's our superpower.
Right. It ensures continuity of care, it protects us legally.
And it allows us to track the patient's progress over time.
Okay, so we've assessed, diagnosed, planned, and implemented.
Right.
Are we done yet?
Not quite.
There's one more.
The final phase of the nursing care plan is evaluation.
Okay.
And this is where we determine whether our interventions have been effective and if the patient has achieved the goals we set.
So it's the moment of truth.
Exactly. But evaluation isn't just a one-time thing we do at the end of the shift or when the patient is discharged.
Right, we're constantly reassessing, gathering new data, and tweaking the plan as needed.
Think of it like using Waze to navigate through traffic.
Okay.
We're constantly getting updates, rerouting, and adjusting our course based on the ever-changing conditions.
And just like with Waze, sometimes we hit unexpected detours or roadblocks.
Right, but that's okay.
Right.
The nursing process is all about adapting to those changes and finding new ways to reach our destination.
So during the evaluation phase, we're asking ourselves questions like,
Did the patient achieve their goals?
okay,
Were the interventions appropriate and effective? Did the patient experience any adverse effects?
yeah.
And are there any changes we need to make to the care plan?
It's a constant cycle of assessment, reassessment, and adjustment.
Exactly.
And that's what makes nursing so dynamic and challenging and ultimately so rewarding.
I couldn't agree more so. We've covered a lot of ground today, folks, but there's still so much more to explore about nursing care plans, and we'll dive into those deeper aspects when we come back for part 2 of this episode.
Until then, keep studying, keep caring, and keep those questions coming.
We'll see you soon. Welcome back, everyone.
All right, so we left off talking about evaluation being this, ongoing process.
Right, like checking ways for detours and roadblocks.
Exactly. But let's backtrack a little bit and revisit that assessment phase.
Okay.
Because getting that right really sets the stage for everything else.
Oh, you are absolutely right. Assessment is where our critical thinking skills really shine.
Yeah.
It's about gathering all those clues, both subjective and objective, and then, weaving them together to form that holistic understanding of the patient's needs.
And it's not always as straightforward as it might seem in a textbook.
Oh, no, definitely not.
Real-life patients don't always present with textbook symptoms.
Right.
And their stories can be, complex and layered.
Absolutely. That's what makes nursing so fascinating.
Yeah.
It's like solving a mystery.
It is.
We have to be incredibly observant, picking up on those subtle cues that might not be immediately apparent.
I remember this one case early in my career.
Oh, yeah.
This patient came in complaining of fatigue and dizziness.
Okay.
And her vital signs were stable. Her blood work was relatively normal.
Okay.
I was stumped.
I bet that was frustrating.
It was. So,
what happened next?
well, I decided to dig a little deeper.
Okay.
And as I was chatting with her, I noticed that she kept rubbing her chest
Okay.
and mentioning this kind of vague feeling of tightness.
Oh.
It wasn't like classic chest pain, but something just didn't feel right.
Yeah, that's where your intuition comes in, that sixth sense we develop as nurses.
Exactly. So I decided to trust my gut.
Okay.
And I ordered an EKG.
And
And wouldn't you know, she was having silent ischemia?
wow, that's incredible. You potentially saved her life
Well,
by being so observant and following your instincts.
it was a real turning point for me.
Yeah.
It taught me the importance of looking beyond the obvious, really listening to the patient's story and trusting that gut feeling.
Absolutely. And that's a lesson that stays with you throughout your career. Sometimes the most crucial clues are hidden in plain sight.
So how can we hone those observational skills
Right.
and make sure that we're not missing those subtle cues?
I think it starts with being present with the patient,
Okay.
really focusing on them and their story.
Yeah, it's easy to get caught up in the tasks and the technology.
Right, but we need to remember that the patient is at the center of everything we do.
Exactly. It's about active listening, observing their body language, picking up on those nonverbal cues that might be telling us more than words ever could.
And it's about asking those open-ended questions,
Right.
encouraging the patient to elaborate,
Hmm.
and not jumping to conclusions too quickly.
Yeah, sometimes the most valuable information comes from those seemingly insignificant details.
Absolutely. I've also found that building rapport with patients is key.
Oh, for sure.
When they feel comfortable and they trust us, they're more likely to open up and share those vulnerable pieces of their story.
It's about creating that human connection.
Yes.
Letting them know that we're truly listening and we care.
Absolutely, and that brings us to another crucial aspect of assessment documentation.
Oh, yes. Documentation.
We have to paint a vivid picture with our words, capturing both the subjective and objective data in a way that's clear, concise, and accurate.
Documentation is like a time machine. It allows us to revisit the patient's journey, track their progress, and ensure continuity of care.
And it's not just for our benefit.
Right.
It's a legal document that can be used in court if necessary.
I always tell my students, if you didn't document it,
Yeah.
it didn't happen.
I love that it's so true. Our documentation reflects our professionalism and our commitment to providing safe and effective care.
Okay, so we've gathered our assessment data, we've documented it thoroughly.
Okay.
Now, what do we do with all this information? How do we make sense of it all?
That's where the diagnosis phase comes in.
Oh, wait.
This is where we shift from data collection to data interpretation.
Okay.
We're analyzing those patterns, connecting the dots, and formulating a nursing diagnosis that accurately reflects the patient's needs.
And those nursing diagnoses are really the cornerstone of our entire care plan.
They are.
They guide our interventions, our goals, everything. But I have to admit, I struggled with this phase as a student.
Oh, yeah.
It felt so abstract and overwhelming.
Oh, I can totally relate to that.
Yeah.
It's one thing to memorize the NANDA list,
Right.
but it's another thing entirely to apply those diagnoses in real-world situations.
Exactly. What clicked for you? How did you overcome that challenge?
For me, it was about seeing the patient as a whole person,
Okay.
not just a collection of symptoms or a medical diagnosis.
So instead of just focusing on the disease process, you were looking at how that disease was affecting the patient's, physical, emotional, and even spiritual well-being.
Exactly. And I started to realize that those nursing diagnoses weren't just abstract terms. They were real-life problems that nurses could address.
Yeah.
Things like pain, anxiety, impaired mobility, risk for infection. All those challenges that patients face on their healing journey.
So it's about taking that medical diagnosis and translating it into the human experience.
Yes.
Understanding how that disease is impacting the patient's life and what we can do to support them through it.
Precisely. It's about seeing the person behind the diagnosis and recognizing that their needs go far beyond just treating their illness.
And once we have that nursing diagnosis, that's when we can start setting those SMART goals.
Right.
And figuring out the best interventions to help the patient achieve those goals.
It all flows from that initial diagnosis. It's like we're building a house.
Okay.
And the nursing diagnosis is the foundation upon which everything else is built.
Okay, so let's talk about those SMART goals.
All right.
We've mentioned them a few times,
Yeah.
but let's really unpack them. Why are they so important to nursing care plans?
Well, SMART goals provide us with a clear direction, a target to aim for.
Okay.
They help us stay focused on the patient's needs and ensure that our interventions are purposeful and effective.
So instead of just saying we want the patient to get better,
Right.
we're setting specific, measurable, attainable, relevant, and time-bound goals that give us a roadmap for their care.
Exactly. Let's say we have a patient who's been diagnosed with a stroke and has impaired mobility.
Okay.
A SMART goal for this patient might be something like, the patient will ambulate 20 feet with the assistance of a walker by the end of the week.
Okay, perfect example.
It's specific. We know exactly what we're aiming for. It's measurable. We can track the distance the patient is able to ambulate.
Right.
It's attainable. It's a realistic goal for this patient's condition. It's relevant. It addresses their impaired mobility.
Right.
And it's time-bound. We've set a time frame for achieving the goal.
And having those SMART goals in place allows us to measure progress,
Right.
make adjustments to the care plan as needed, and celebrate those successes along the way.
Absolutely. It's so rewarding to see our patients achieving those milestones and regaining their independence.
Now, those goals are crucial, but they're only part of the equation. We also need to figure out the best interventions to help the patient reach those goals, and that's where our critical thinking skills really come into play.
Right. We have to consider a wide range of factors like the patient's medical history, their current condition, their preferences, their support system, and the resources we have available.
And we have to be flexible and adaptable because no two patients are alike, and their needs can change rapidly.
Exactly. It's not a one-size-fits-all approach we have to tailor our interventions to each individual patient.
So how do we go about choosing the right interventions? What factors do we consider?
Well, first and foremost, we need to make sure that the interventions are evidence-based.
Okay.
We want to use practices that have been proven to be effective and safe.
So we're not just pulling these interventions out of thin air.
Right.
We're relying on research, best practices, and clinical guidelines to guide our decisions.
And we also need to consider the patient's preferences and values.
Right.
What's important to them? What are their goals? We want to involve them in the decision-making process as much as possible.
That makes sense. We're not just treating a disease.
Right.
We're caring for a person.
Exactly. And we need to consider the potential risks and benefits of each intervention.
Okay.
Are there any side effects or complications we need to be aware of? Are there any contraindications based on the patient's medical history or current medications?
And we have to be mindful of the patient's cultural background and beliefs.
Absolutely.
What might be considered an acceptable intervention in one culture might be taboo in another.
It's about being culturally sensitive and respectful of our patients' diverse needs and perspectives.
Okay, so we've considered all these factors. We've chosen our intervention.
Okay.
What happens next?
Well, now it's time to implement those interventions, but before we jump in, it's crucial to prioritize them.
Right, we have to figure out what needs to be done first, what can wait, and what can be delegated to other members of the healthcare team.
And that prioritization process requires critical thinking and clinical judgment. We have to assess the patient's current condition, their vital signs, their level of pain, any potential complications,
Right.
and then determine the most urgent needs.
So for instance, if a patient is experiencing shortness of breath,
Yeah.
Our top priority would be to assess their airway, provide oxygen if needed, and notify the doctor.
Exactly. That would take precedence over things like ambulation or medication administration, which could be addressed later.
And once we've addressed those immediate needs, we can focus on the other interventions in our care plan,
Right.
delegating tasks as appropriate, and always monitoring the patient's response.
And of course, we're documenting everything we do every step of the way.
Of course, documentation is key.
Our documentation serves as a record of our actions, the patient's response, and any changes we make to the care plan.
It's like a detailed journal of the patient's journey,
Exactly.
providing valuable information for the entire healthcare team.
So we've assessed, diagnosed, planned, implemented, and documented.
Are we done yet?
Well, there's one final phase we need to talk about: evaluation.
Evaluation.
And I think it's worth dedicating a whole segment to this.
Yeah.
Because it's where we really see the fruits of our labor, where we determine if our interventions have made a difference.
You're so right. Evaluation is crucial, and we'll dive deep into its nuances and importance when we return for the final part of this episode. So stay tuned, folks. We'll be back after a quick break to explore the final stage of the nursing care plan. Welcome back, everyone.
We've made it to the final stage of the nursing care plan process.
Yeah, we've journeyed through assessment, diagnosis, planning, and implementation.
And now it's time to talk about evaluation.
Evaluation.
It's where we really see the impact of our work.
Yeah.
You know, it's about holding ourselves accountable.
Yeah.
And ensuring that our interventions are truly making a difference in our patients' lives.
It's more than just, checking off boxes on a form.
Right.
It's about critically analyzing our actions, celebrating our successes, and learning from our challenges.
Exactly. Remember those SMART goals we set?
Evaluation is where we measure our progress against those goals
Okay.
and determine whether we've hit the mark.
And it's not a one-time thing that we do, at the end of the shift or when the patient's discharged.
No, it's not.
It's an ongoing process that's woven throughout that entire nursing process.
Right. We're constantly gathering data, reassessing, and making adjustments to the care plan based on how the patient is responding.
So let's say we've implemented our interventions. We've been diligently monitoring our patient, and now it's time for that formal evaluation.
Okay.
What are some key questions we should be asking ourselves?
Well, first and foremost, did the patient achieve the goals we set?
Okay.
Did those SMART goals get smarter because of our interventions?
Right. We need to compare the patient's current status to those desired outcomes. Did their pain level decrease? Did their mobility improve? Did their anxiety lessen?
And if the goals were met, fantastic. But if not, we need to figure out why.
So let's say a patient's pain level hasn't decreased as much as we'd hoped. What are some questions we might ask ourselves to kind of troubleshoot that situation?
Well, we might ask, were the interventions appropriate for this particular patient?
Okay.
Were they implemented correctly? Did the patient adhere to the plan?
Okay.
Were there any unforeseen factors that influenced their progress?
Right. Maybe the patient wasn't comfortable with the, pain management strategy that we initially chose, or perhaps there were some underlying issues that we didn't fully address in our initial assessment.
Exactly. Evaluation is all about digging deeper, asking those why questions, and using that information to refine our approach.
And it's not just about evaluating our interventions, it's also about evaluating the patient's overall experience.
Absolutely. Patient satisfaction is a key indicator of quality care. We want to know if the patient felt heard, understood, and respected.
Did they feel involved in their care? Were their concerns addressed promptly? Did they feel like we were partners in their healing journey?
And we can gather this feedback through, direct conversation surveys or even by observing the patient's nonverbal cues.
Sometimes a patient might hesitate to verbalize their concerns, but their body language might be telling a different story.
Right. It's about being attuned to those subtle cues and creating a space where patients feel safe expressing themselves.
And I think evaluation is also a time for us to reflect on our own performance as nurses.
Absolutely. Continuous learning and professional development are essential in nursing. We should always strive to be the best versions of ourselves for our patients.
So during the evaluation phase, we might ask ourselves, did I use my skills and knowledge effectively? Did I communicate clearly with the patient and the healthcare team? Did I document everything thoroughly and accurately?
It's about acknowledging our strengths, identifying areas for improvement, and seeking out opportunities to grow and learn.
It strikes me that evaluation really brings that cyclical nature of the nursing process full circle.
It absolutely does. Evaluation isn't truly the end. It's the beginning of the next cycle of assessment, diagnosis, planning, implementation, and evaluation.
We're constantly learning, adapting, and refining our approach to provide the best possible care for our patients.
And that's what makes nursing such a dynamic and rewarding profession.
It really is. So as we wrap up this deep dive into nursing care plans, what are some key takeaways we want our listeners to remember?
I think the most important thing is to embrace that cyclical nature of the nursing process.
Yeah.
You know, it's a continuous loop of assessment, reassessment, and adjustment, always with the patient at the center.
And remember those free nursing books that we mentioned earlier?
Yes.
They can be a fantastic resource as you continue to learn and grow in your practice.
Absolutely.
Don't be afraid to dive into those resources, explore different perspectives, and ask questions.
The more you learn, the more confident and competent you'll become in developing and implementing effective nursing care plans.
Well, we hope you've enjoyed this deep dive into nursing care plans. Feel free to share your thoughts and insights in the comments below, and let us know what topics you'd like us to explore in future episodes.
Until next time, keep learning, keep caring, and keep rocking the nursing world.
See you on our next deep dive.